38 weeks pregnant, what to expect. This week, you just can't stop peeing, your baby is nearly ready to be born, and it's time for your partner to help you plan ahead. Here's all the essential information you need to know once you get to 38 weeks pregnant. How big is my baby at 38 weeks? Your baby is now the length of a leek and is still growing rapidly, now weighing 7 pounds and measuring around 28 inches in length. While it could be any time now that your baby decides to make her grand appearance, the maximum time is 4 weeks, so you're nearly there. What's my baby doing at 38 weeks? Your baby is a fully functioning little human, though she's still practicing breathing and swallowing. If you've got a baby boy, then his testicles have descended into the scrotum by now. And little girls might have slightly enlarged breasts. This is just the effect of your hormones and will go down after birth. Your placenta is also fully grown and weighs a whole 1 pound and 9 ounces. Your baby's lungs are still maturing and producing surfactant, the substance that prevents the lungs' air sacs from sticking together once she starts to breathe. She's also shedding vernix and lanugo and swallowing amniotic fluid. Your baby's irises, the colored part of the eye, may gain more pigment in the months after she's born, but they usually won't get lighter or bluer. And green, hazel, and brown eyes have more pigment than gray or blue eyes. She's also fine-tuning her brain and nervous system in these last important weeks, and also adding fat, perfect for creating a pair of adorable chubby cheeks for you to squeeze. As for her eye color, you may not be able to tell right away. If she's born with brown eyes, they'll probably stay brown, whereas if she's born with gray or dark blue eyes, they may stay gray or blue, or turn green, hazel, or brown by the time she's 9 months old. The reason for this is that your baby's irises, the colored part of the eye, may gain more pigment in the months after she's born, but they usually won't get any lighter or bluer, and green, hazel, and brown eyes have more pigment than gray or blue eyes. What is my body doing at 38 weeks? You might feel like you're spending most of your life on the toilet. The pressure of your bladder is so extreme now that it's squished into a pancake. Seriously. But annoying as it is, you should keep hydrated. Another reason you might have to set up camp in the loo is that you could have diarrhea now too. Oh, the joy. If so, it's your body making room for the baby to emerge. Yup, it's a sign your small one is on his or her way soon. Words of advice: avoid rich, fatty, or fiber-rich foods and instead eat light soups, toast, and ice lollies. And if leaking from your bottom end isn't enough, your breasts, which by now might be of gigantic proportions, could be discharging a thin, yellowish fluid called colostrum. It's basically the first milk your baby will get, which is full of antibodies, and has less fat, and sugar, and more protein than the milk that arrives later. If this affects you, it's probably not the time to wear your best floaty silk whistles tops. And if it's more full-on seepage than mere droplets, pop some nursing pads into your bra. Your last antenatal appointment is this week, unless you go overdue, so make a list of any last-minute questions to ask your midwife. 38 weeks pregnant symptoms. 1. Constant urination. Thanks to the position of your baby's head in your pelvis, there's less room for your bladder, but the trips to the toilet are becoming a more and more frequent event. Don't cut out liquids as hydration is more important than ever as you get close to the birth, but consider skipping caffeine as it could make these bathroom visits even more frequent. 2. Braxton Hicks. If you've noticed more frequent and intense Braxton Hicks contractions, this usually signals that labor is not far away. Get your partner to practice your breathing and visualization techniques with you. 3. Nesting instinct. The urge to clean has never been so strong. Although it's understandable you want to make a beautiful home for your baby, make sure you're not using your valuable childbirth energy all up on scrubbing the sink. 4. Bloody show. The mucus discharge tinged with pink, brown, or red blood will soon be making an appearance. Keep your eyes peeled for it and call your doctor or midwife once it appears, as it usually means labor is not far off. Thanks for watching. If this video was helpful, like and share it with your friends.